This is the meeting on Committee for Progress and Development. It's now in session. Secretary, please call the roll.
Senators Williams,
Present.
Washington, President, Lewis, Moon, Nicola.
Okay. Okay, I know Senator Lewis is going to be out today, so do we got Nicola or Moon coming? Send a note over. Okay, so Jim. Okay, so what we'll do is start as a subcommittee of one, and we will allow Senator Washington to come before the committee. We're starting with Senate Bill 871. Okay, let's hear it, Senator.
Thank you, Mr. Chair. Senate Bill 871 has been filed a couple of times before. This is to make some modifications to our Pregnancy-Associated Mortality Review Board. As you know, I represent the 9th District. This legislation is a critical, we need to update the structure to our state's Pregnancy Assisted Mortality Review Board. As you may or may not know, we face a persistent maternal health crisis. We have the data telling us that mothers are dying, but this will give us the tools so that we know the right people and the right tools to understand why they're dying and how to stop those deaths. I believe Missouri right now ranks 8th in the country on maternal mortality, and that is not a city issue or a rural issue, but a statewide issue from the entire state. So the first provision we'd like to change is to expand the number of board members from 18, where it currently is, to 22. And we also want to include in that a member from each of Missouri's 8 congressional districts. There are women that are dying, especially when they're low income, everywhere in the state, and we do not have representation from every area in the state. In fact, data shows that the rural areas suffered the most mortality ratios, highest mortality ratios. The second provision that we want to address is what the board looks at, and we're asking that it now, currently it requires the board to evaluate the level and timing of prenatal and postnatal care, the adequacy, oh Lord, I can't talk about it, nobody else can. The adequacy of the data that the board is collecting, and a review of successful approaches taking both in Missouri and our adjoined states. We do know that 80% of our pregnancy-related deaths in Missouri are preventable, but if we look at the timing, we can identify exactly where the handoff between providers fail, particularly in the high-risk first year postpartum. Now, in Provision 4, what we like to do is get more disaggregated in the data so we know where the most help is needed. So we're asking that the data be broken down by the race, ethnicity, language, nationality, age, and most importantly, the zip code. We can't fix what we can't see. If there's a zip code in the Boot Hill or a specific neighborhood in Kansas City, seeing a cluster of preventable deaths, this data will allow the Department of Health to deploy targeted resources rather than one size fits all. It's kind of similar to like a cancer cluster. Like you don't know where to go with that cancer cluster if you don't know where the deaths are. And so that would help. In closing, we lose about 70 women every year to pregnancy-associated causes in Missouri. And for each one of these, that's a mother that has left behind a family and a child who won't have a mom. So it's about accountability, representation, and precision. It turns our Mortality Review Board into a more effective shield for Missouri's mothers. And I thank the committee for your time and ask for your favorable support. And I'm open to any questions.
Okay. With that, Senator Moon, you just got here, so I don't know if you had a chance to hear much about the bill.
I did not, but I'll have some questions later.
Okay, so how about we allow some witnesses to come up, if that's okay, in favor, and maybe they'll give us some insight on it, maybe help with your questions.
You bet.
Make sure you say all your witnesses.
Yes, ma'am.
Welcome.
Hi. Thank you for having me. Thank you. My name is Kimberly Costello. I'm with the Doula Foundation in Springfield, Missouri, but we serve the entire Southwest Missouri for 25 years as a community-based doula program. And so we have seen the data and have data from 25 years of serving Medicaid and impoverished families across the state who have been experiencing, of course, pregnancy and then in the postpartum period. We, in our program, have already been witnessing a lot of these numbers that the PAMA report brings out. But what we are here today is to speak in favor of this PAMA report for a number of reasons. Number one, we provide case management and care coordination for these families. We're identifying and addressing social determinants of health. So we see the numbers that are coming from this report. We have been seeing that for 25 years, but we needed the awareness of these challenges that we're facing in our communities and with these families. And so we are in favor of, we do like the fact that we are adding numbers to represent the entire state across the state, because we also have maternal health deserts, a number of counties that are maternal health deserts in the state of Missouri. And we do feel that representation across the state, but also added data is very important to what we do. I will tell you that prior to the PAMA report coming out, it was difficult for us to get information to the right people and the right systems to let them know of the challenges that we were seeing in a community-based setting, because we work together with the clinical setting and non-clinical. So now that this data has been reported, it actually has brought a lot of awareness to the right systems at the state level and in different communities that has actually helped us to be able to support more families in need. I am now serving on multiple statewide task force meetings and collaborations that are actually using this data to improve maternal health outcomes in Missouri, and that is absolutely what we are in favor of. I will tell you one small example of how this is supported. We had a mom just recently, and this is one of many, that was expecting a baby. She has a 5-year-old, a 2-year-old, and she's expecting a baby. Lost her husband suddenly at 7.5 months pregnant. She is 10 years clean and sober, had changed her life. They had really rehabilitated their lives. At 7.5 months pregnant, she loses her husband suddenly from a stroke, and now she is faced with an insurmountable task to be able to raise these children and give birth completely alone. When we were able to support her and provide support services, now substance use has re-entered into her life because of this tragic circumstance. But because of our interventions, identifying and addressing these needs and surrounding her with gap services, this mom is reunited with her children. We kept children out of the foster care system. She is rehabilitated. She is clean and sober, and she is now working full-time at a local hospital and helping others. So there are so many stories like this, but it actually helps so much for people like us that are boots on the ground to be able to have the data and the support systems in place so that everyone's listening and everyone is taking this information seriously to be able to make a better impact for maternal health in Missouri.
Thank you, Ms. Costello. I appreciate that.
Thank you.
With that, any questions from any members of the committee? Senator Moon.
Thank you for your testimony. I must have missed what you were talking about with regard to the services, particularly the mom you mentioned recently. And lastly, what type of help are you able to provide her and others who might need it?
Yes, and I didn't know, respectful to time here, how deeply I could go into that story. But what we're able to do as a community-based doula program, we are also dual certified as a perinatal community health worker as well. So we go along and do social work side of things to really help that mom. So when she was tested positive for substance use, when she went into labor, those children were at risk for being removed from the home, number one. So we were able to help the grandmother be able to register as a foster care parent, keep the children in the same home together, and have a family member caring for them. As a community-based doula group, we helped support the grandmother with a newborn baby and 2 other children that have just lost their father and now they've lost their mother. Now the mother, we were able to get her enrolled into a substance use residential service. So she moved into that residential service. We helped provide services for her as a postpartum mom who just gave birth, but also who is trying to rehabilitate her life and get through rehabilitation with substance use disorder. In those additional pieces, we were able to bring in mental health services, housing services that were able to support them, food insecurity services, and then also parenting education and postpartum education to be able to take better care of herself and help set them up, the family up for success. We stayed with them for an entire 12 months postpartum. And so this mom would have been, I feel very strongly, one of these statistics in this PAMR report in the next year, because we were able to provide that support that she needed and systems in place with home visitation and care coordination to get the services that she needed in place. She was able to very immediately enter into a relationship that we already had in the community for that substance use disorder for residential services that usually typically has a waiting list. And so we were able to get them those pieces in place with also the mental health support for for all the older children also, because again, they just lost their father and their mother very suddenly.
So if it's okay, Jim, I think we're going to just do a roll call real quick so we can, well,
There's 3 of
there's
us.
3 of us. Okay. I paid close attention to that book you gave me when I became a chair. Well, no, not yet. So I would like to, make a roll call so we can go into out of our subcommittee. So I'd like to make a motion out of our subcommittee. So just call a roll? Okay, cool. All right, with that,
Senators Williams,
present.
Washington,
Present.
Lewis, Moon. Here. Nicola.
Thank you. All right, so with that, we'll continue on. Thank you, Ms. Costello. No
Thank you.
questions for
Thank
me.
you, Ms. Costello.
Thank you.
Okay, with that, we have any additional witnesses? In support?
I'll be very quick.
I think we just got Kelvin left.
Good afternoon, Mr. Chair and members of the committee. Sharon Galway-Jones here today in support on behalf of the Missouri NAACP. Maternal health, particularly Black maternal health, is very important to the members of the NAACP. We have done multiple projects around the state, particularly in southeast Missouri, where oftentimes women have to cross state lines in order to get to a hospital in order to give birth safely. We love the doula program. We think that having this data and being able to track it is incredibly important, and support the bill. Oh, sorry. I have to give the statistic I was told very specifically. Black women are 2.5 times more likely to suffer from mortality or morbidity in the state of Missouri than their white peers when it comes to giving birth and carrying children.
Thank you. Any questions from members of the committee? Senator Moon.
Thank you, Mr. Chairman. Thank you for your testimony. Where in the state are they crossing state lines in order to give birth safely?
South of Sikeston, I believe. The closest hospitals are on the other side of the state line in either Arkansas or Mississippi. And I'm looking back at the doula folks in Tennessee. Yeah, but particularly south of Sikeston is where we see the biggest problem. I believe the closest hospital that would be capable of handling a high needs birth with a NICU is either in St. Louis or even further into Memphis.
Okay, thank
I'm
you.
getting nods, yes.
Thank you, Sharon.
Thank you.
So how many witnesses do we have here present in support? Okay, cool. Simmons, I think you're up next. So we have four. Okay. So we have Chris and, okay, cool.
Mr. Chairman, members of the committee, my name is Kelvin Simmons. I'm contract lobbyist here representing the Health Forward Foundation of Kansas City. We are here to strongly support Senator Washington's bill, SB 871. I would like to tell you that our stance basically is that the modification that would take place with the Pregnancy Associated Mortality Review Board as it pertains to disaggregation of data is absolutely necessary, especially as you disaggregate on the basis of race, ethnicity, language, nationality, age, zip code. We think that this is a high priority because it would help with the improvement of maternal and infant mortality by giving health providers information needed to understand these disparities that are taking place throughout Missouri. We think that, and it has already been stated, that black babies and mothers in Missouri have a higher mortality rate than their white or Latino counterparts according to data by the United Health Foundation. We also think disaggregating the data by the dimensions identified in this piece of legislation can better help connect expecting mothers to prenatal care, birthing facilities, and postpartum services, according to the joint report by the Urban Institute. This will help to improve maternal health outcomes by closing gaps in maternal care throughout pregnancy and in the key months after postpartum. Again, we think that the data available on a disaggregated basis can better target resources and design and implement programs that have the most meaningful impact on expecting mothers and those who have recently given birth. We also would like to say that we believe that there is built-in privacy. We think that the bill clearly requires compliance with the state and federal privacy laws, and it prohibits the release of identifiable data. At this point in time, again, we would like to say that we're fully supportive of this bill, and I would stand for any questions that you might have.
Thank you, Kelvin. Any questions of members of the committee? So I would like to ask a question, and just to kind of make sure the committee is clear on what this bill does. This is really providing information, a study that would create access to health care, correct?
No, so we already have a maternal mortality review board, and so this would expand the scope and the number of and the amount of representation in terms of increasing the number of members and where they come from.
Got it. Thank you.
Good. Thank you, sir.
State your name and your purpose.
Good afternoon, Mr. Chairman. Chris Ropey. I am here on behalf of Nurture KC, which is a local non-for-profit in Kansas City that serves pregnant women and their children in the 6 zip codes of Kansas City with the highest rate of infant mortality through one of our many programs called Healthy Start. We are extremely supportive of this legislation. It falls deeply within our organization's passion and commitment and mission and what we do, and think this is a great step to continue to get this very, very serious problem under control, and glad to support the Senator's efforts to do such.
Any questions from the member of the committee? Lucky day, Chris. Thank you. Next. State your name and your purpose.
Chair, members of the committee, Henry Telemock with the Missouri Boot Heel Regional Consortium. I think the witnesses before me did provide some information regarding Southeast Missouri. We serve within the region, actually within Sykeston, Missouri, and I can provide some more statistics, right? This Pregnancy Mortality Review Board has provided information that shows about 80% of deaths were preventable. Some of these were related to SUDs, which the board will be able to provide more information on based off of the going from 18 to 22 members, all within congressional districts, as well as look into insurance and any discrepancies within race and inequity. For our purposes in the Boot Heel, we do serve some of the most impoverished areas of the state. If you were to talk to stakeholders within departments, they themselves will tell you Southeast Missouri is at the forefront, sadly leading the charge in some not so great statistics, right? 38.7% of those who live in a micropolitan area, out of 38.7 deaths occur out of 1,000 deaths within pregnancies, something that we'd like to see severely reduced and proactively approached. So we thank Senator Washington for sponsoring this and look forward to working with everyone on it.
Thank you for that. I appreciate it. Any questions of members of the committee?
I do.
Senator Moon.
Either of you can answer. I was thinking about the numbers of additional members, 4, I think. Where are they likely to come from?
I think one, we need members that are north of what I would say US 36, so then the north part of the state, basically from state line to state line from Kansas to Illinois. We have an OBGYN desert there, and we have a lot of deaths up there, so we would need a couple of people from there. And I think we'd have to look to see where the other ones would come from, but there is no real representation north of US 36, so like north of Hannibal or on the western side, that would be Cameron.
Okay, thank you.
Thank you, Mr. Chair. Any more witnesses in support? Is everybody? Anyone in opposition?
Good morning, Mr. Chairman, members of the committee. My name is Arnie C. A.C. Dienoff, State Public Advocate. And even though I want to save lives, I believe that this is a duplication of services. I believe that we have many divisions, many departments, many public health departments, many universities across our state, medical grants, medical examiners, medical associations, public health amongst probably over 100, I would say 90 counties or some joint counties that are smaller and have joint public health departments. But I believe that this is a duplication of services. We value life 100%. I think everybody wants to solve the problem. But when you increase board members from 18 to 22, that increases government and things don't get done. So I'd like to actually see a decrease in the amount of people. If you have 18 members, if you decrease it to 16, that would give 8 members or 8 congressional districts. That'd be 2 citizens or 2 experts in the different health fields. You could split it, 8 citizens throughout the congressional districts and 8 professionals from the various places. The fiscal note that comes across this is very concerning. As you all know, we're facing a huge deficit, and if you all read the red flag and the warning that was put up last month by the state treasurer, Scott Fitzgerald, we are facing a $2 billion deficit. In this, my opinion, this fiscal note is going to be another $366,000 to come up with additional funding and appropriations. Our state budget is very important. I feel that this is being done, this is being studied on many parameters. There's even grants that we have from the federal government and grants through our State Department of Public Health that is looking at this mortality rate. For those reasons, I cannot support this bill. I cannot support growing government. I cannot support adding additional government appointees to a board. These numbers just don't work. They never get anything done. We have a lot of boards and commissions. Missouri is one of the top states in the nation that has appointee of boards and commissions. Every time somebody comes up with an idea, we have an advisory board or a commission or something like that. And so it just goes on and on. A lot of these reports have dust. Nobody ever acts on their recommendations, and therefore I cannot support HB 871. Thank you, Mr. Chairman.
Thank you for your comments. Any questions from a member of the committee? Yes, sir. Senator Moon.
Thank you. Thank you for your testimony. I'm also concerned about the fiscal implications too, but I didn't see a fiscal note. So can you tell me what,
Sure.
in your view, will be the cost of the 4 additional members?
I don't know if they get a stipend. I know, for example, the State Transportation Commission, which I go and testify there regularly every month, they get a $50 stipend. But they also get flown by this Missouri State Highway Patrol throughout the state because they're spread out through 6 out of the 8 congressional districts. I had it up here. It was a 360. Here we go. It was for fiscal year 2027. It's a $315,342 fiscal note. Then it goes up in 28 to $363,360, and in 29 fiscal year it goes up to $366,101. Some of the net effect is $250,000 for implementation of the act, which Senator Washington has talked about in her opening remarks. These are they received comments from the Missouri Department of Health and Senior Services, which enacts Chapter 192.990.4. And they say it's going to be staff review of current members, identify new members to meet the requirements. It sounds like, if I read this real quick, it sounds like they're having a hard time finding the requirements of getting some of these slots throughout the state. Talks about travel expenses that are reimbursed to the members. Talks about the stipend and a consultant. So we're hiring a consultant in addition to stipends of the members. It says 13 meetings would cost an additional $3,900. They estimate the cost to be $300 a meeting. And then there's some other notes talking about oversight costs to the Department of Health and Senior Services. And there's kind of a breakdown on they want to hire another employee for personnel salary. Fringe benefits are $43,000. Salary is $74,000. Goes up to $93,000 in fiscal year 2029. Equipment, so that would be for just an additional employee to take on this, FTE, full-time employee, it's $156,221.
And on that note, is this the fiscal note that was prepared for this bill? It was? Okay. I'll
Yes.
have access to that soon enough. Thanks for pointing that out. I'll take a look.
Sure.
Thank you.
Thank you very much for your comments. I appreciate it.
Thank you so much.
Any other, anyone else in opposition? Okay, with that will conclude all our testimony. Senator Washington, do you have any closing remarks?
Yes. We're asking that the committee be expanded at a rate of about $4,500 per life to save. We lose about 70 women a year to maternal mortality. And so we're talking about increasing that, just asking for a total of $4,500 to save a woman's life. A woman that can be there for her children, a woman that can work, she can buy groceries, she can pay taxes until our income taxes or whatever we're going to do with them, but she'll pay sales taxes, she'll pay property taxes, she'll put economic development where it needs to be in this state, and she will be alive. And so I think $3 $315,000 is on the low end of what we spend, and $4,500 per saving a mother it's a bargain. It's a basement bargain. We know that when the mother is healthy, the family is healthy. And I'm just asking for support to make sure that we know where we are having the most challenges, because our numbers are still atrocious, so that we can save the lives of women in Missouri.
Thank you for that. I appreciate it. Okay, with that, that will conclude the hearing on Senate Bill 871. Senator Washington, stay right there. I think you got one last one. Senate Bill 873. With that, I'm ready when you are.
Chairman Williams and Member Moon. Thank you for the opportunity to present 873. This builds up on our longstanding commitment to supporting survivors of domestic violence. We have strong nonprofit organizations and crisis centers that do amazing work. Housing remains a barrier for those that attempt to escape abuse. This creates incentives for property owners to be a part of the solution by converting abandoned properties into operational shelters and by making residential rentals available to survivors. It's practical, it's cost effective, and it expands housing, and we know we have a big homeless problem. It has passed out of this committee for the last 2 years unanimously. The main points would expand existing tax credits. So our current law provides tax credits for donations to domestic violence shelters and rape crisis centers. This will increase that to property owners to provide direct housing for survivors. It gives a $1,000 tax credit if you convert an abandoned property into a functioning shelter, and it helps increase available safe spaces. It grants a $500 tax credit to those who rent residential units to domestic violence survivors, and it also helps create stable and independent housing. It's one of the biggest barriers for survivors escaping abuse, and this bill will create financial incentives to help expand those housing options. In Kansas City, we do have housing grants. We voted as a city to put, I think, $50 million in a housing trust, and it has a positive effect on our homeless numbers. This is a cost-effective public policy. It's a minimal fiscal impact, and it utilizes existing resources like the abandoned properties and private rentals, rather than relying solely on state funding. Our current law focuses on shelters but doesn't address the housing gap that we have for survivors. And this will incentivize the private sector so that we have public-private partnership. And we take our abandoned properties and make them shelters instead of allowing them to be hazards in our community. And we all know that stable housing is essential for the break of the cycle of abuse. So this is something that is needed and necessary. We do have folks in my own community, in my district, that are attempting to turn houses into small domestic violence shelters. They just need a little help. And so we're not talking about giving them a lot of money, but we're just asking that we can encourage our private industry to participate in this. So the fiscal note for fiscal year 2027 would be zero. The most it could exceed in 2029 would be 329, and that depends on how many people would actually apply for those tax credits. But remember, when they apply for those tax credits, that means that those people now have a home, and that those people can now go get a job, and they can reunify themselves into the community, into society. And I'll answer any questions.
With that, any questions of committee? Okay.
Thank you, Senator. We're going to have a stare down. I understand how to verify the $1,000 credit. In verifying the $500 credit, what sort of process will be taken?
So that
To
they have to be it has to be a verified domestic violence survivor that will come from a domestic violence assistance program.
Right.
So it can't just be, oh, I got beat up or whatever the case may be. If we can't find anything in the court system or in our domestic violence organizations throughout the state, then a credit cannot be had.
Okay, very good. And then you may know my position on tax credits in general.
I do.
Is there another way that we could incentivize outside the tax credit program?
we can give them some money. And I'd rather not do that. I'd rather make you work for it, because we have seen sometimes that when we just give direct grants, especially in the property ownership arena, that we don't see what we don't get the outcomes that we want. And so this is, remember, it's a credit. So you got to actually be paying taxes in order to get this. This is not something that you get if you're not already paying taxes. And we can make that a non-refundable tax credit so that you can't get any cash off of it, that it would just be a reduction of your tax liability.
Are these transferable?
No, they wouldn't be transferable. And if they are in the bill, we can fix that.
Okay, very good. Thank you.
You're welcome.
Do we have any witnesses in support?
Hi, my name is Starla Wolf-Brennan. I'm the Executive Director of Amethyst Place in Kansas City. We are a nonprofit agency. We've been around for over 25 years. And each year we serve over 300 women and children recovering from generational poverty, substance use, and trauma. And for 80% of the families we serve, that trauma includes enduring domestic violence and the struggles that go along with that to flee those abusive situations. These are single mothers. They have very limited resources and housing options. And as a result, after these families bravely leave their abusive relationships, 100% of them are unhoused prior to entering our program. Our wait list averages 90 families, and it generally takes over a year for them to even get into our program and into safe housing. This experience is shared by many other organizations that support survivors of domestic violence. In Kansas City alone, we lack almost 64,000 units of affordable housing for renters who have low incomes. Based on the intersection of poverty and domestic violence experiences we see at Amethyst Place, many of these families would benefit from the creation of housing for survivors of domestic violence. We desperately need more safe housing options. The tax credits offered in SB873 would help incentivize the creation of more housing options for survivors of domestic violence. We need more shelters for emergency housing, which provide families with a place to go after fleeing an abusive situation. But we also need more landlords who are willing to rent to survivors of domestic violence who may have rental histories and backgrounds that make them a less ideal tenant than someone who does not have these trauma histories. A tax credit for specifically housing this population may inspire some landlords to make more allowances for these circumstances. More safe housing resources are vital for survivors to escape those abusive relationships, and particularly for those with children who cannot risk being unhoused. By providing the tools to generate more housing for this population, we are paving the way for all the healing that must follow to help survivors of domestic violence achieve healthy, brighter futures. I ask you to please support SB 873 so that we are leveraging all the tools necessary to make this possible.
Thank you for that testimony. It was very helpful and insightful. Any questions from members of the committee? Oh, wow. You did a really good job. Thank you so much for your time, and that was an exceptional testimony.
Thank you.
I think we have Jeremy, you coming up in support, correct? Okay, thank you.
Thank you, Mr. Chairman, members of the committee. Jeremy Lefevre appearing today on behalf of my client, Empower Missouri. Empower Missouri is the state's oldest social advocacy organization. They work on housing, food security, and criminal justice reform. In the housing space, this is a top priority for us. And as a personal note, I used to be the chairman of the Missouri Coalition Against Domestic and Sexual Violence, and for years, this is what we hear of as the challenges for getting people into safe, quality, affordable housing. And I understand the tax credit argument, and I get that, but this truly is, like the senator talked about, a partnership between private industry, private individuals, and a government that wants to help. That wants to help those that need it, but is also finding ourselves in a financial challenging time. And so how do we marry those two things between a government that knows it can help and knows it wants to help, but can only get so far. And then you've got great people that want to help from the private side and the industry side, and they're only getting so far. And if we can make this just match up just a little bit, and each give a little bit, where the landlords and everybody are going to give a little grace on this side, and the government's going to give a little bit on this side, and it's got an opportunity to really elevate the quality of life for, obviously, not just the women that are impacted, but we heard the children and the second generations that come up from that. It's a you hate to talk about return on investment with something like this, but we live in a world where that's important. And this is one of the best returns on investment that we can do as a government, I believe.
Yeah, thank you for that. I do want to make a quick comment. It's also safe to say that the housing crisis has enhanced tremendously since the pandemic. So it's been an even higher need for housing and access to individuals that are subject to domestic violence. Okay, thank you. Senator Moon.
Thank you. I should have asked the question of the witness before, but you said
I could make one up.
Well, some of the same things that might be, and we could talk afterward too, if you don't have the answer. And I'm not sure exactly how to phrase the question, except that I'm not sure how or if it's necessary for some of the potential tenants to identify themselves as a victim. And I know it has to be done for the tax credit purpose, but are we seeing in some segments of our society in Missouri where maybe there's a premonition of something and they don't want to lease their house to a certain individual? Or is it essentially a monetary thing where they might not have the money that's being asked for the house or the apartment?
It's a bit of both, Senator, because
Okay.
a lot of domestic violence victims, some landlords will be afraid because whoever the abuser is may find them and that sort of thing. So we definitely want to keep that type of anonymity. But also, a lot of domestic violence survivors, when they do find a shelter, or something like Amethyst Place, where it's even longer term, then they don't work for a while, and they put those addresses in as their last address, and the landlord kind of knows that's where they came from as well.
Understand. Thank you.
Couldn't have
Thank
said
you,
it better
Jeremy. I
myself.
appreciate your testimony.
Thank you so much, Mr. Chairman. Thank you, Senator. Appreciate you. Oh, I'm
Any
not
other
stealing your pen.
witnesses in support? What about those in the back? Everybody good?
That's my intern.
Okay. All right, cool. All right, so with that, Senator Washington.
You didn't call against.
Oh. I wouldn't be, sorry, I overlooked you over there.
No, that's okay.
My apologies.
No problem.
Anyone in opposition?
Thank you very much, Mr. Chairman, members of the committee. Sorry about that. My name is Arnie C., AC Dinoff, State Public Advocate. Again, this is another duplication of services. People who truly want to help out Missourians and the less fortunate, it's from the heart. It's not having both hands out and saying, what can I profit or what can I get by helping victims of domestic abuse? I'm the first one to stand up for the prevention and to help people in need. But it comes from organizations. It comes from not-for-profits. It doesn't come from corporations or LLCs who come in and want to make a profit and have their hands up at both ends. It has to come from the heart to help people. Unfortunately, in my opinion, after looking at the fiscal note and calling the Department of Revenue, this is a tradable tax credit. Tax credits in Missouri, we have been known as the capital out of 50 states, I believe, probably 49 for sure, as the state or the capital of tax credits of the nation. Our tax credits are getting way out of control, and that's why we're in the fiscal constraints that we are, and we need to cut our budget by $2 million by fiscal year 2027. Tax credits in Missouri have become a commodity. They have become lucrative, and they have becoming a trading sensation about who can get the most tax credits to benefit their pockets, their corporations, their profits, and their bonuses. This fiscal note for this is another $341,256. additional FTE to from the Department of Revenue to institute this program. The amount of tax credits for this program are appropriated currently at $5,771,000. There needs to be tough choices made by this committee and by the full Senate and the General Assembly as a whole. We're going to hear from Governor Kehoe in just about 2 hours about where he stands on taxes, where he stands on the budget. And if you all read the huge three-ringer binder that was put out about the facts about the 2026 fiscal budget from the Office of OA, Division of Budget, it's astonishing about the cuts that we have to make. And I don't know how many of you actually read that, but I have. So again, if people want to help people, they need to help from the heart. When I give to charities, when I donate to charities that I believe in, I donate from the heart, and I don't expect to have my hands out getting a return on investment and getting some type of profitability. It has to come from the heart. So therefore, there's no way I can support yet another tax credit that does nothing but hire a political appointee and doesn't do what it really needs to do, the programs, because the authorized $5,771,000 isn't even being fully used. It's only being used about 50%. I believe the fiscal note says of that $5.7 million, they're actually using in fiscal year 2025 $2,977,743, and that would be page 407 of the fiscal note dated on January 12th, which was yesterday. And so therefore, I cannot support in good conscience SB 873. Thank you, Mr. Chairman.
Thank you very much for your comments. Is there any questions, members of the committee? Very good. Thank you so much for your testimony.
Thank you.
With that, Senator Washington, did you have any
Absolutely.
closing statements?
All right. So the current program only goes to domestic violence shelters and those sorts of centers. What we are asking is so that we, just in Kansas City alone, you heard Ms. Brennan testify that there are over 60,000 domestic violence victims alone waiting for housing. So we don't have enough shelters. We don't have enough residential places. So this is just expanding that to allow another option for housing. So to allow private landlords to give housing. There was a comment about a political appointee. There will be no political appointee. This is not a commission. As we talk about help from the heart, we all shop at Walmart, and they hire low-income people because they get a tax credit for it. And we know that housing is an issue, and affordable housing is an issue, which is why we have low-income housing tax credits. It's why we give tax credits for historic. While I'm not the favorite of tax credits, we just watched the Kansas City Chiefs leave Kansas City after 70-some-odd years for a tax credit. So tax credits do help spur economic development. They help create jobs. And in this case, they help save lives, because that once you have a place that you can lay your head down inside of a building with you and your children and escape the perils of domestic violence, you can be back on the road to being a productive citizen. So, we talked about, I think Senator Moon asked me if they were tradable or transferable. That's an easy fix to make sure that they're not transferable. I've done a tax credit for urban farming. As we know, it is not transferable, and no other tax credit I've ever gotten passed through here is a transferable tax credit, and we can keep it like that. So I do ask that we try to make Missouri a place where everybody wants to come and people want to stay. And the way we do that is we keep our homeless people off the streets, and we keep our domestic violence people from becoming homeless. And this bill goes a long way to do that, and I ask for your support. Thank you.
Thank you very much for that. With that, that will conclude the hearing on Senate Bill 873. With that, I would like to make a motion to adjourn. Second. All right, so moved. Second. With that, we adjourn. Thank you all for your time. This is the conclusion of the Committee on Progress and Development.